Hi, everyone. Hi. Long time no see, and welcome to another exciting episode of Pharma Insights, the talk show brought to you by Platforce, where we explore the intersection of technology, strategy, and innovation in the pharmaceutical industry. For those who already know, I'm Juliana, and for those who don't, I'm Juliana Kreisel, event manager at Platforce, and I'll be one of your moderators for today. Omnichannel strategies are not longer a luxury in the pharmaceutical industry. They are very essential for engaging customers in the digital area. But how is the rise of omnichannel transforming the way pharma companies connect with HCPs and patients? Join us to explore how digital media and omnichannels are reshaping the pharma landscapes. In this case, we have prepared a very interesting panel from leading experts, and they're going to discuss the trends, challenges, and opportunities, as well as we're going to, for the first time, we have a lot, well, not first, but we have a lot of comments written on the event that we're going to tackle as well. So for all of you who have not written their questions or comments, please do it. So before we start, and you know that I'm not doing this by myself because I couldn't, I will invite my co-host for today, Mr. Stefan Repin, Head of Marketing at Platforce. Hi, Steph. How are you doing today?
Hey, doing good, thank you. Hello, hey everyone from Argentina. Today I'm here. Next day, tomorrow, I don't know. That's how
We can
fast.
play.
That's how fast the pharma market is moving, basically. Um, so I'm really excited today to talk about Omnichannel. That's not the never-ending topic, but we have new guests, which gives us the opportunity to express and work through new ideas. And I have two amazing guests here. I'm really excited to see Thomas because we've been knowing Thomas for some time. It's really great to find him on this podcast, and we have a new guest. His name is Chima. His nickname is Chima. Um, his official name is José Maria Guido Avila, but please do call him Chima.
Nice. I was sure you're going to pronounce that correctly.
Chima seems like more manageable, but I'm also very excited, to be honest, because this is the first time we actually have comments even before we start the show. So we have something to work on, and I'm really happy because that shows that we're doing a good thing. We have the engagement. Everyone who's listening to this, even after the webinar, thank you guys for being with us. Here's the love for you. Please do comment what you want to hear before even the webinar starts. I hope this is the beginning of a good practice.
Yes.
Let's start.
Okay, first we're going to introduce Thomas. How Thomas? Thomas or Thomas? I don't know how. Or
It's Thomas is perfectly fine. So hey everyone, my name is Thomas, former Novartis head of digital medical affairs for the innovation lab at Digital Medical Affairs. So my role was to drive innovation in all things digital within the medical affairs space, touching from medical communications, field force, working with the medical teams on their omni-channel engagement plans and how to scale projects utilizing AI. So I'm really happy to be here. Thank you for the invite, Stefan. Really nice to see you again, Juliana. And just looking forward to a really great discussion here with my colleague, Chema.
thank you. Thank you for that. And then we have our new speaker here, Tema. How are you doing?
Hi, I'm fine, thank you. Thank you for the invite, and hello, everyone. Yeah, if I can introduce myself, my name is very well done, Stefan. Jose Maria Guido Avila, but obviously because it's so long, people know me as Chema, and I'm currently working as global patient experience lead for respiratory diseases in Dupixent in Sanofi, and but I have been working in the pharma industry. Believe it, I know I look younger, but I've been working in the industry for more than 20 years, and mostly, like, let's say 80% of that time has been in HCP marketing and omnichannel execution.
Thank you. Thank you for that. I think that's a curse of from people that speak in Spanish. I don't know if you speak in Spanish, but for people that has Spanish names, that we look way younger than we are.
Is that the trick?
That is the trick. That is
the trick.
very good genetics.
No.
Okay, Thank you guys for being here. We really appreciate it, and thank you our attendees for taking the time. We love to hear from you. So, as I said before, please leave your comments and questions so we can bring it here to the panel. So, as Stefan mentioned before, we had some comments and questions written prior for the attendees for you guys, the panelists. So we thought that will be very nice to start to discuss one of them. So first, I will bring a comment from Oliver Connors. He says, one question for the speakers. How can smaller pharma companies leverage omni-channel strategies without the same resources as larger organizations? I see that's a common issue. Who would like to tackle that? Tomasz, we were speaking prior,
Yeah.
we started,
No,
so you can take it.
Yeah, this is a great question. And I was really excited to be able to use this platform to kind of answer that space. And I see a lot of it. I attend a lot of webinars. I was doing a lot of speaking sessions, and this comes across a lot of times, right? How can my company, we're a smaller biotech, where we're up and coming, compete, right? And I think that the nimbleness and their ability to make decisions quicker and scale is actually an advantage. But the one thing that I would want to first ask, right, is what does omnichannel mean for you? Is there's a different definition for Novartis, there's a different definition for Sanofi, and your biotech yourself. So how can you first answer that question? And to me, I always look at it as how can we provide the best customer experience? So how can the HCPs that interact with all of our brands and all of our touch points have a similar cohesive message that makes it easy for them to gain access to the folks that they need to, whether it's an MSL, whether it's a rep, whether it's a medical information content piece? How can they educate themselves to be the best doctors possible in their specialty to, at the end of the day, help patients? And then also, what are we doing as an organization to help with patient support services, making them easier to find trials, make it easier for them to find maybe reimbursement applications? So that is the first thing that you need to ask yourself is, first and foremost, what can I do to create the best customer experience? And that may be requiring talking to somebody from marketing, maybe hiring somebody who has a marketing specialty. Medical, we don't sell anything, but that doesn't mean we can't leverage and borrow ideas from that sense to create an experience that is very rewarding and fulfilling. And that's where I think would be a good starting point. Of course, we'll talk about scaling in terms of utilizing AI, making sure your data is all synced up, and you have the data master systems, you have your CRM tied in, you're looking at it from an insight perspective. But I think the first question asking yourself is, how is the customer journey related to all the different touch points? And I'll turn it over to Chairman right now to give his insight.
Yeah, I think it's thank you, Stefan. I think it's honestly, I would say it's a blessing to not have resources in omnichannel, and I will tell you why. Because pharma in general, and by the way, I need to disclaim that my company asked me to disclaim that this what I'm saying is actually my opinion, not necessarily reflecting the opinion of my company, Sanofi. But what I have seen in pharma in many companies is that when you have budget and resources, you put a lot of things at risk, and then you try to minimize that risk as much as possible. So typically, the pharma industry, how does it go? Right? It's we do a market research, we develop personas, and those personas are always the same personas, right? We continue to pay the same money for the trailblazer doctor, the innovator doctor, the guideline follower doctor. It's just different names, right? But ultimately, we end up in the same 4 personalities. So that's step number 1. You don't need market research to identify those personas. You know exactly who they are already. Second point, pharma, you develop the messages. And I did some experiments recently about, I asked ChatGPT to create, messages I actually, the prompt that I gave to ChatGPT was create fictitious medicine and develop the key messages for that fictitious medicine, but please adapt the key messages to 4 different personalities. A personality that is an innovator, another one that is a risk avoider, and etc. So kind of reflecting that. And ChatGPT gave me all the key messages very easily, right? So again, I was actually showing it to one of the creative agencies, and they were like, "Oh my gosh, we're scared." They're doing because of this thing, right? But I think the most important part that you were describing, Tomasz, is you can experiment right now, so you can already learn in the execution, because it's a dream for the pharma industry to go into that model where you identify what is that experience from your customer, and you work in improving it. Pharma is very slow in that sense, because it's more about, so once you have the messages, then you go and you test those messages, right? And then you do more market research to be able to say, okay, this message resonates better for this persona. So by this time, it's already, you're talking about already 6 to 9 months, right? And then on those 9 months, your customers already changed preferences a long time, several times. Whereas if you don't have the budget to do all of that, you go to market very quickly, you show your messages, you do A/B testing, and there are many platforms that are not necessarily costly to do A/B testing, and then you learn from that execution, and then you improve, and you're actually moving faster and learning along the way. Am I back? Can you hear me?
Yeah.
Yes, you're back. You're back.
Yeah, and then you learn from that execution. So that was that would be my 2 cents to that.
Thank you, Stefan. I know you wanted to talk much.
I have my 5 cents as well. So I have just had this morning an extremely enlightening discussion with Stefan. He was a keynote speaker, I think, at Next Pharma, and he's very well known in Europe when it comes to pharma. And we've had already so many discussions about Omni-Channel so far, and we're still not over it, because I'm seeing pharma being very hesitant in implementing Omni-Channel, and I do understand, because there is a lot of fear. One, in what if something goes wrong, and second is, with Viva you have basically the recent actions in Viva 2. They're basically splitting from Salesforce, and then they're introducing basically the new Omni-Channel experience, where the sales rep or the field rep is not anymore the central piece, but it's more of a e-commerce setting, where you have all these channels, and one of them is the medical, as the sales rep, as the field rep. And the question here is more like, when you're implementing an omni-channel approach, is the field rep in your particular, if we talk about generics, yeah, maybe the e-commerce shopping approach will work, because you give a lot of information to your HCPs, your healthcare providers, and then they will sort of like, you wait for inbound, and you have next actions. They're all going to be digital. But when we talk about, in particular, there's a question here, best way of evaluating ROI of omnichannel in pharma for prescription drugs. That's a very, very, very good question. In that case, I don't think the shopping experience or the e-commerce experience, which Viva, for example, wants to implement with its new CRM, I don't even want to know the name. I don't want to even name it, because we're Platforce, so we just want to sit with Platforce. Then basically it anonymizes the rep, and it takes out the power from the sales rep. And I think the sales rep, the field reps, haven't said their last words when it comes to omnichannel, and I think they still have a lot of influence on doctors. So if you ask me, what's the best way of implementing omnichannel in a smaller company? First of all, I think it's, instead of paying millions of dollars for the research and focusing only on the marketing research and creating this persona, which might not be even your real persona, you have to base your decision on the data. Bad data comes, as they say, bad data comes in, there's going to be garbage out. So not even your e-shopping experience, not even your expensive Viva software, not even your IQV expensive software will help you with your next best action, because that's going to be garbage. So the first thing that you need to make sure when you get an omnichannel if you want to get an omnichannel experience, which is truly bringing ROI, is look into your data. What sort of data you're bringing in? And second, you need to decide where do you need to want to put the HCP. Not HCP, sorry, the sales rep. Is the sales rep basically the one who orchestrates it, or you want to put marketing in the ones who orchestrate it, and sales rep is just a channel, or anything like that? You don't believe me. You don't need expensive tools for that. You need just to sit on the same table with medical, commercial, and decide how you're gonna enable this. My 5 cents. Thank you so much.
No, Stefan, that's fantastic. That cross collaboration between medical, commercial, marketing is vital. The one thing that I also that I want to add is working for a smaller company. You could have your executive leaderships directly communicating with key opinion leaders and digital opinion leaders. So you're eliminating an additional layer. You're getting right to the source. And if you're trying to build that rapport, that establish that credibility, what better way to do it than having your executives actually make time and meet with the doctors?
Hmm.
Mhm.
Yes. Guys, we are having an engagement from from the audience, so we're going to go to present questions, and then we will move for the others in the past. So let me put it here. His question is hot, so it's a very hot question. What's the best way of evaluating ROI of omnichannel in the pharma for Era X? Sorry, I'm going to add Chema here.
Sorry, yeah.
There you go.
I don't know why I'm losing connection. Sorry.
It's okay. Who wants to tackle that? Chema, do you want to go first as Thomas was?
Yeah,
Okay, cool.
I can go first. I think that because what I have seen again is the very first experiment I saw when we were trying to evaluate digital marketing versus traditional. I remember we were doing some experiments a long time ago, and we did like a group of doctors only visited by reps, and another group of doctors visited by reps plus a rep triggered email. And we from that time, I remember in some of the countries we're able to follow up and identify that doctors either for example through message testing, the doctors remembered more the message, or in countries where they had IQVIA data, they were able to see that the group of doctors with email and face-to-face plus email was trending higher in terms of more new prescriptions. Uh, but I think that there are now more sophisticated tools, statistical models that I have seen where you can identify how the different channels are contributing to new prescriptions or to sales in general. And you can go as granular. If you have the right data, coming back to the point of the right data, you can definitely get the you can definitely put it there. The key point I would say on data as well is uh, you have to be careful not to go into the vanity metric area, because I have seen many people, for example, when you develop a webinar for or your triggered emails or whatever channel, many marketing teams are focusing only on open rates and click-through rates, and it's like, okay, we achieved 20% click-through rate, open rate, and then the next question is, okay, what is the benchmark? Oh, 2018. Oh, we are better than the benchmark. Great. And then we clap, and then nothing happens. And then the question, what I have been trying to inspire in many teams is, why don't you look at the 80% who didn't open? So analyze the behaviors of that 80% who didn't open, and maybe this is the wrong channel or maybe the wrong topic, but dig deeper into that data so that you can identify. And then once you start making those tweaks, then you will start to get the right data, and then you can apply these statistical models to identify contribution of ROI to different channels, right? So the levels of investment versus contribution in sales, and this is how you can going into measuring. I don't know, Thomas, if you have a
No, you're absolutely right. And sometimes we do focus on open rate, click-through rate, time spent on content, but we don't know if the doctor just clicked on the email and then just left his browser open and we see that he's been on the website for 40 hours. It must mean we have a fantastic website, right? But that doesn't necessarily mean that that the depth of engagement is there, and you need to go a little bit beyond that what was there a conversion rate, right? Was there a specific action that we wanted out of the email or the interaction? Was it to sign up for a webinar, or after the webinar, did they request more information? Did they spend time looking for it? Did they interact with our chat bots? Stuff like that is that you need to be looking at. I also like to see like the frequency, if the frequency like behavioral metrics are being involved. So what about customer loyalty? Are we able to look at a sustained interest? Are they looking at it from moving within the funnel, right? And how that can kind of be influenced as well. So these are definitely actions to be looking at in terms of like your ROI. You're also looking at like net promoter score. Two, you could send out surveys, you could get feedback that way, direct feedback from your MSLs. I mean, they spend on average 45 minutes with the doctor. They can ask questions whether the communication efforts that they were putting out are valuable. Are they not looking at it? Is it too much, too frequent? Maybe it's not within the interest. So that's where Chem was talking about the A/B testing. Maybe different email headings had a higher click-through rate than the others. Maybe it was a time. You know your doctor. You know that they are a very early morning person. So maybe use an AI automated tool to send out emails very early in the morning. So when they up at 5, they get to look at it. Maybe they're a night bird. That's where they do all their stuff. So triggered to be sending at 7 p.m. But all of that is personality behavior that needs to come in. And what Chema said in the beginning, your data needs to be there. Your personalities, your personas need to be there. And all of that needs to be seen with going back to what I said in the beginning is how to create the best customer experience. And you yourself need to know who your customers are. And I'm using the word customer, but you know, your doctors, who your ACPs are, and how to create the best experience for them.
Thank you. Thank you for that. We have another this is not a question, it's a comment from Barry. It says, the pharma profiles often send this strategy off course because of course, sorry, because they are usually generic. They don't factor in jobs to be done and are shoehorned to fit in the strategic plan. The result is generic messaging and weak propositions. I see Chemai over there.
Actually, I'm looking for the emojis to click on hearts to that comment. Like I would push like 100 hearts or likes in that comment because it's exactly what I was referring to. Because sorry, and I just went ahead, Thomas, because it's one of the things that I've been passionate about. I do believe that there is at some point there was a value in developing these pharma profiles, but I think that when I started seeing the same trends, either people go into that trend of finding those generic profiles for personalities, and then it becomes generic and they remain in a slide, right? One of the things that I saw at some point in my career was having different personas, but sending the same message to everybody. And then my question was like, what is the whole point of having personas if you cannot run a specific campaign for each of the personas and measure success by persona? Or the second, the other thing that I've seen is personas more based on what do we believe they should look like based on treatment approaches, like second line believers, or like the new mechanism of action believers, or it's not how people behave. It's like one thing that I told one time was, imagine if Coca-Cola, I hate these comparisons, but anyway, I'm going to do it. Imagine if Coca-Cola would plan the next TV spot saying, I'm going to target architects. So this TV spot is going to target architects, and then I'm going to do another campaign for engineers. And it's like, that's not how they think about that, right? Not because you have the same profession, you think the same. It's the same for cardiologists, for internal medicine. Just because all of them are cardiologists doesn't mean that they behave the same. True. Right? And this is what we do in pharma. So sorry, you see, I'm very passionate about this topic.
Great.
I'm going to shut up and then
that's a great.
All the jobs are done, another like industry. So we should forget around. I'm seeing this all over, like a lot of services. People focus too much. Sorry, guys, for intruding. People focus too much. Salespeople, marketers focus too much on the industry, location, stuff like that, which does not matter at all. Does not matter at all. What matters the most is like, what's your job to be done? What do you want to get done with it? What's my personal motivation? That connects us way more than location, like industry. I am an internal in medicine, or I'm a surgeon, or anything like that. Thomas, you can take it.
No, no, I agree. And I really like the jobs to be done approach when I'm tackling projects. So I really like seeing that. And I do agree with Chema about if you try to block personalities. I actually like the Coca-Cola analogy. The one thing that I just will say is, humans, right? Like we all are, we're all informed by fact, but we're driven by emotion. So I
True.
think that there needs to be an emotional connection to the messaging. And I think there needs to be a little bit of storytelling associated with it. You can say 25% reduction in X, Y, and Z, or you can say patient was able to walk his daughter down the aisle, as she got married. There's a level of connection there that sometimes may stop somebody and say, oh, wow, and give it a little bit more thought, right? Even with like the Coca-Cola messaging and all the other messages that you're looking at, they're selling you an emotion. They're selling you something that you want to belong somewhere, that will elevate you as a person, and then that's it. So everything that we're trying to get sold to, right? And we as people just get sold to constantly on a daily basis. Everyone's selling us something. And think about yourself. Was what messaging hits? What did you respond to? What did you just flag spam or click delete? And what made you really open up that? I'm like, okay, was it a timing? Was it a need? Was it a compelling story? And then how can we translate that into the messaging that we have? Because we have all the data. We just need to a better way to articulate it.
I agree.
And
Into
can
the
I add something else? Because
yeah,
sorry,
please.
I know we have a lot of questions, but I love what you're saying, Thomas, because the emotion here is where omni-channel comes in, and personalization and customer experience come in, because the message, the emotion is going to be different for the different personalities of the doctors, right? So for a doctor, knowing how the patient the benefit for the patient is going to resonate better. Whereas, for example, for another doctor is going to be more like, okay, I'm able to, be ahead of my peers. I because I get experience on this product, and then I can educate, and that increases my profile as a KOL, for example. So we need to be able to your point on understanding the customer. We need to understand what emotions are driving the different personalities of the doctors, or different interests or affinities, to be able to tweak not just the message and but the execution. On the emotion, just a quick another from another industry. I was at some point trying to research a little bit more on practices on the gaming industry, especially video gaming and online gaming. And one of the things that I noticed in the research was that when you get an advertisement in your phone for a game, either you are in a social media or whatever, some of them actually make it very frustrating for you to watch. It's very interesting, because they are playing the game and they're losing, but
Yes,
they're losing in a very silly way, and you're like,
yes,
I
it's
could
true.
do better. I could do better than this. So it's like, I'm gonna click,
And
and
you're
I'm
so
gonna,
smart saying like you should do this.
yeah. So you see, and that's another, they're tapping into our brain, into, to get it done. So we should do something like that in pharma too.
I agree. Well, not related to pharma, but Quilmes, it is actually a very big beer company here in Argentina. And for Argentinian people, they will know what I'm talking about. When I was younger, they did this amazing publicity, like ads and campaigns for Quilmes, and it was very good because it was very relatable and it was very fun. For example, I was a kid and my mom could relate to what they were saying, but I could relate as well. And then they did the same with guys. They did with vacation places and things like that. It was very good because it gives you that emotion. I like that about the emotion. And the thing about the games is absolutely true. I feel like Einstein when I'm watching those ads because I could do better.
And,
um,
and a pharma example can be, if we like look at dermatology, for example, right? We could run an ad that asks, is this psoriasis? And you have 4 different slides. and the doctor might be compelled to say, hey, I know what that is, or 3 out of 4, click on what you think is X, Y, and Z indication. And then they click, there's a sense of reward, and then you could send them to the landing page of your medical information website. And then would you like more information? So stuff like that, you can utilize these tactics, the gamification, the emotional aspect in messaging for pharma.
Yes, I completely agree. We have another question, and this is from, it says, to what extent can omnichannel approach in healthcare serve as a replacement for traditional face-to-face visits with doctors? Are there specific scenarios or limitations where face-to-face interactions remain indispensable? Tomasz, do you want to tackle that as Chema?
I'm assuming that the question means MSL visits and in-person symposiums, synops. So digital is here, right? Digital is here to stay. I know we're nothing beats face-to-face, nothing beats a handshake.
Sure.
But the timing, there's an availability issue. There's a travel component to it as well. There might be a geographical distance, right? So if your MSLs are territory based, and there might be a doctor that you're trying to reach in a region that might not fall into it, or the travel just doesn't make sense. Virtual MSL is a fantastic idea. You can definitely have an entire virtual omni-channel group, especially if you're in a startup or smaller pharma company, that you could run all your digital channels that way. So even though face-to-face, in my opinion, is indispensable because you have a little bit more of that personality touch, I wouldn't say and discredit virtual and digital engagements. So I think an optimal blend would be fantastic. Maybe you could prioritize face-to-face, but digital is definitely there, should be as part of the toolkit.
Thank you. Chema, do you want to tackle that?
Yeah, I in my experience, I was actually trying to push for, because at some point in the pandemic, there were many people thinking that reps were going to be replaced, and the sales teams were very afraid of this. And I think that coming back to the point of measuring success and ROI, we actually identified that depending on the market and the market meaning country, and depending on the brand, market in terms of the brand and competition, there are models where remote worked better than face-to-face, and also face-to-face plus remote or face-to-face plus digital work better. So I would say I agree with Tomasz. I don't think face-to-face or the people are going away anytime soon. It's about identifying the specifics for your market. I don't think there is a one size fits all. And also, I think we need to be asking this question again in 5 years from now, because the Gen Z, they have completely different behaviors. Right now, we have, I think, 5 different generations in the workplace, or I think 5 or 4, and Gen Z is coming, right? So imagine a Gen Z rep talking to a Gen X doctor or a baby boomer doctor, right? So those complexities we're shifting, right? Because and it's another topic I've been passionate about in the past few years, and researching behaviors of the new generations. And there is, I found, for example, if you compare a baby boomer and a Gen Z, when they have an issue with a service or with a product, the baby boomer, they want to go to the store, talk to a person, and get it solved. And if you ask a Gen Z, they're like, no human contact, no human contact. I'm gonna go into Google, ChatGPT, Reddit, etc., and I'm gonna look at my own answers, and I'm gonna answer the question myself. I don't need a human. If you want me to chat with someone, put me a chatbot, and I can figure out the algorithm. Where do I want to go to answer my question? So imagine this when this Gen Z is predominantly doctors and reps, how those interactions are gonna be, if with those behaviors. So I think it's this question is constantly, the answer to this question is going to be constantly evolving.
There's a certain model. There's a group called Foresight, and they're an organization that you can join as a company, and you could also ask and lead these types of discussions internally. Is how will the future look like? How will the future of health look like? How will the future of interactions look like? If we go back, right, the baby boomer generation, if you would have told them, hey, in 20 years, no one will want to go in person into the store, they would look at you like you were crazy, right? Or even just 5 years ago, if you said, hey, all your clinical trials must have pandemic contingencies written into them, they would have laughed you out of the room, right?
Yeah,
Hey,
yeah,
what happens
yeah.
if the world shuts down? How is your trial going to ensure progression and that there's no dropout? It's stuff like this that now we need to really have a focus on. So, but what Chema said is understanding the population, but then also the up and coming population who will be then your customer in the next 5, 10, 15 years. And are you able to look at this? So I would highly recommend people look at Foresight. There's like a Foresight Academy, and start doing these little experiments that way as well.
Thank you. I will mark in my calendar that in 5 years from now, we're going to have the same discussion and see how everything
Great.
evolves.
I love it.
We have another question from Mara. She says, how do you see the increasing competition in Viva and Salesforce? What challenges or benefits does it bring to marketing orchestrating? How we should evaluate the changes? We're going into... Chema, do you want to tackle it?
I'm.
You can say
I don't
no.
know. I mean, yeah, I'm hesitant about it because this is one of the things that. Okay, just I'm just gonna say something, my 2 cents, and then I will hand over to Thomas. But my thinking is, when it comes to big companies or big solutions, and then splitting, it's I don't think it's good for the customer, because ultimately we are gonna end up, I don't know, we're gonna end up having maybe 2 different services for the same single purpose. And on the one hand, having competition, it helps to to improve and then to find different solutions, etc. But on the other hand, my concern is that the pharma industry, as I said, not just one company, but in general, the pharma industry, the customer journeys that we were talking about in the beginning, they're only pushing branded messages. That's all, and they're very linear customer journeys. It's like put your customer here, send them the email, and then if they don't open, send them to the webinar, and then send them a reminder. So like 20 reminders until they open up and they read your content. And it's nothing about really understanding. So my thinking is that those solutions are actually focused to feed that machine that is pushing the branded messages, and not necessarily into getting the feedback loop and understanding more the customers. So that's why I was hesitant, because I'm not necessarily optimistic about these things.
Right.
So go for it, Thomas.
I have to agree, Chema, is that Viva and Salesforce, the CRM, they're mainly tools, right? And they're mainly tools, and these tools are as good as the data you put in, and then as the loops you feed back outside. So healthy competition is always fantastic. They are the name brand, but I feel like there's other companies out there that might know the customer a little bit better. Like when I was scaling AI projects, and we went with the #1 largest company like in the world, I felt that their engineers maybe didn't have that much understanding of our space, which is fine. They were very smart in AI and NLP, but there were other smaller startups that I felt had a better understanding of what the challenges of a medical information medical writer needed day to day, but they didn't have the tools to scale. So you have to figure out what is best for your company, and then how you can leverage these ebbs and flows essentially. But Viva and Salesforce, these CRMs, they're tools. You need to just make sure that you have a robust data foundation. So is your data storage scalable? Is it cloud based? Are you running on something that is easily accessible? Do you have the data quality and governance checks in place? And I think that would be a good start there.
Okay. Steph, do you
Yeah,
want
my
to add?
personal stance would be I've been following Philip.
You're muted. Steph, you're muted.
Sorry, Philip Witt is one of the guests on our show, and he's often coming. I'm following him on LinkedIn. He's just been to the Viva Summit, and he's come up with. There was something very interesting on all over the airport in Madrid. So they had the Viva Summit. The announcement they made were in Madrid, and all over the airport they had Salesforce advertising, and all over the city they had Salesforce advertising. So they were like basically saying, okay, there's the Viva Summit, but we're still there. We're Salesforce, so you can get us. From the experience I have talking to multiple leaders in pharma is that Viva has the experience in pharma that Salesforce doesn't yet have. So a lot of the engineers who are supposed to integrate now Salesforce and IQVIA into systems, they do not have the experience that Viva has with pharma. So you have to basically, like, pharma companies were complaining that you have to teach the technicians, the language processing companies, or whoever is going to do the integration for you, you have to teach them what pharma is basically. So that's the big, you were saying, Chima, about the loss that the user will have to lose, the customer, the user, which are two different categories. Like a lot, people oversimplify pharma, and then they say, well, you have HCPs. In fact, the HCP is not our client, is not a pharma client. The end user is our client basically, but the end user is the one paying, but we are the advertised HCPs. And what's different is that we don't have in Europe, for example, direct to customers advertising, but we do have that in America, and then the flow looks a little bit different, and that's why oversimplifying pharma and looking at it as many tech companies do is a big mistake, and I think it's going to be hard for Salesforce to scale into pharma. I think they'll do that like they've done with many other markets, but it's not going to be that easy as they thought initially, I think.
Thank you. We have a lot of questions, so we're going to go with another question from Sandra. She was part of our webinars. Hi, Sandra. How are you doing? How can the integration of AI and machine learning within omnichannel strategies revolutionize patient engagement and adherence in ways we haven't yet considered? I can
Do you want
see.
me to go first? You want me to
Yeah,
go first?
please, Emma. All yours.
I do believe that question deserves its own webinar. uh,
We're going to do
because
another one with Sandra and Tema, and we're going, of course, to invite Tomasz as well.
you got it. Yes. Because I believe that there were, when in patient marketing, I think there are, if the group thinking, what I would call, or actually let's call it the pharma comfort zone. At some point I named it the pharma comfort zone, which is, doing your typical personas and then pushing branded messages. I call it pharma comfort zone because it's a model, let's be honest, it's a model that works. It's been working forever. It's very profitable. And that's why people don't see the need of moving away from that model. So now, so there are many misconceptions around HCPs and profiles, personas, customer preferences, etc. Patients, it's even far beyond. Like topics like, can we personalize? Can we do omni-channel for patients, for example, right? And even one step before, are they really patients? Do we treat them as patients in the pharma industry only because they're patients, and we just see them as someone who has a disease, and that is preventing us from actually understanding them as consumers, as people? And one of the things that I did, this is again my own research. I tried to calculate from a specific disease how much time the patient spends researching information about the disease, symptoms and treatments, etc., and how much time that the patient or the person spends in the rest of the online time in a typical day. and it's only searching for topics about their disease. It's only 3%. So, and the whole pharma industry focuses on that part, on the disease, like keyword research, I don't know, search engine optimization to identify when patients are searching for symptoms or etc. Which we're only tapping on the 3%. But if you look beyond, um, you will see that those patients may be consuming content that it's related to their disease, but it's not necessarily like crystal clear. One example I can give you is these specific patients that I'm telling you. They are actually very interested in dating because of the age they are. But now, what if you, instead of coming with a campaign telling them you are, and actually, and I'm integrating the usage of AI within this, right? Because you need AI. So I've been working with a company that uses AI to tap into this information and identify the interests of different patient populations or consumer populations. And we found out by using that AI, we found that those patients were interested in dating. So instead of doing a typical message of your disease is not controlled, go talk to your doctor, the message was don't have an issue in front of your date. So don't have an episode in front of your date, right? Because that would be embarrassing. So maybe go to your doctor to control your disease so that you don't have to experience this this fear of having the episode in front of your date. And that was
Oh, we lost Cham again, but he is back. People, don't worry.
I'm back.
There you go.
Sorry. Um, so and that message of the dating was much more meaningful and more engaging for the consumers because it was much more relatable to the situation they were living. So we stopped thinking about it as patients, and we were able to uncover only those insights through AI. Um, and this is more before prescription, right? There are other alternatives for adherence, but again, like I said, you see, I already talked for a couple of minutes, and then we're just like scratching the surface.
And Chema, you used storytelling and emotion to drive the people to your channel. You didn't say, "Hey, this reduced it by 25%," and then you went on your way. You said, "Hey, don't have this in front of your date," because you knew that that was also important. And that's that persona building, and that's what you can kind of get as well. And I agree. Sometimes, we ask Dr. Google, WebMD. We spend a lot of times researching an indication before we even make that appointment, before we even go to the doctor. We as humans, we want to be the best patients as possible. How are you feeling? Oh, I'm wonderful. And we know that's not true. We
Yeah.
know that we've had, we felt like not well for a long time. So to answer the question too, integration AI, what about wearables? What about devices, pharmacy records? Can we utilize this information to not only get a better picture of the understanding, but can we also trigger reminders, medication adherence, alerting in HCP, maybe a biometric level dropped, right, or their caregiver. There was a company, a startup that I was talking to that created a companion app for cancer patients out of a need because her father passed away. And the question, it was an app that every day just asked you, how are you feeling? How did you sleep? Did you drink any water? And you had a check, right? A time period of what their physical, mental health kind of was. And this was not only shared with their HCP, but with their caregiver. So they got a snapshot. Because when they asked them, oh, hey, Dad, how are you feeling? I'm feeling great. But they said, hey, I slept like 3 out of 10. I was really thirsty. Does that mean there's a potential AE coming up? Can you start triggering a reminder there? So that's how we can kind of utilize AI in that sense, but also, as Chema said, to put it towards your omni-channel engagement, get the persona, find an indication, maybe guide them to a patient support group. They could talk to other people, building that community, utilizing emotion and storytelling. And I think that's how you have ways that maybe haven't been considered before. So hopefully we answered that question, Sandra. But as Chema said, this could be a topic, an hour-long discussion.
We can do it. You ask and we can do it. We can make it happen. So we have another question from Claudio. He says, as pharma shifts towards specialty drugs, does omnichannel communication become more complex when MSLs and access teams also engage with customers? And he gives an example: challenges in aligning messaging, customer segmentation, or data sharing. Tomas, do you
So
want to?
yeah, so I can, and this is what I said in the very beginning, is understanding your customer and understanding how their interactions are with the different touch points and making sure that they're all synced. So if you have marketing and again, Chema said this, I said it, you need like an insight group, like a cross collaboration group between medical, commercial, marketing, sales, share insights. There shouldn't be a word like insight protectionism, making sure that the CRMs are talking to them, because you have MSLs calling on the doctors, you have the medical directors calling on the doctors, you have sales reps calling on the doctors, the commercial groups you have the clinical trial teams calling on them. Are making sure that no one's sending out 6 emails in a day. When was the last visit? What was the feedback? What was the click-through rate? All of this data you have internally. I'm hoping that you do. Make sure that you're utilizing it, you're scaling it, it's clean, it's in a cloud-based solution. You have a master data management system, and then you can utilize it that way, and that should really reduce the challenges in aligning the messages.
Thank you. Chema, do you want to?
Yeah, I'm just gonna add briefly because we're closer
Almost
to
done.
finish. Yeah,
Yes.
almost done, right? I think, yeah, I think the key that we have been learning a lot as an industry how many silos we used to have. We still have, right? Thomas, you're right. I've seen examples where the same doctor or even pharmacists, because I remember back in the day we were also targeting pharmacists. The same pharmacist was receiving um, multiple messages from different groups, up to 5, right, in a single in a single execution, and these teams were not talking to each other. And so I guess it's about. Um, I think that those silos are breaking now because there in the past there was this people hiding behind the process and saying, "Oh no, it's not. We are. It is not compliant to talk to doctors about this." And or this, well, compliance, not compliance maybe the right way, but medicals, for example, medicals were more like, no, we're talking about the science, and you guys are talking about the commercial part with your brand colors. And but I think that thinking is going away, and now we're looking at it more as a cross-functional effort. And I think this is, the more we evolve these mindsets, it's gonna this is gonna become much more cohesive. And I think AI is gonna help us with that as
Yeah.
well, because
Yeah.
right now the issue is processing the data from all the multiple departments, and and give us a recommendation on what to do next as a cross-functional team. Humans, it's difficult to execute with humans, but now if you have an AI helping you with that, I think it's gonna improve.
Yeah, 100%. Set automated tasks. And like I said, at the end of the day, go back to understanding your customer and seeing, do they want 5 emails in a row from you guys? They're going to say, hey, do you guys not talk to each other? And the answer is no, because you're siloed. So again, going back to the original question, what can I do as a small organization? You could be a better company to engage with your HCPs. So don't look at it as hey, we're going against these Goliaths. No, is you guys are more nimble. You could set the priorities, you could set the strategy, and you could have, at the end of the day, provide a better customer experience.
Thank you. Thank you. Guys, we are 5 minutes away for ending. So I was going to tackle another question, but I think it will take too long. So I don't know if you guys want to give us a final note or a final message to our attendees regarding the topic, or do you want to answer one more question? It's up to you.
We could answer one more question, I think.
Okay.
We could give like a
We are having the last
The
question of the day.
90-second challenge.
give people their money's worth, right? They paid good money to be here.
During COVID pandemic, we implemented omnichannel healthcare solutions, but the ROI was not as expected. Given the challenges of how low levels of utilization and the busy schedules of doctors, what strategies can we adopt to improve the ROI of our, one second, omnichannel services while maintaining efficiency and quality of care?
Mhm.
Chema, do you want to
Yeah.
tackle that?
uh, yes, it's probably well. I think it's probably going to be. I'm just curious because I was not necessarily under the impression that the activities during the pandemic were didn't get the results because I was under the impression that we actually moved a lot because before the pandemic, it for me it was very difficult to convince teams to go into digital and to explain that the customers are people and they are expecting an experience same as they are experiencing in other industries. And after the pandemic, everybody started to reach out like Chema. Remember that thing that you were talking about before, Omni something? Can you help us? And we revolutionized. We did a lot of things to the point that many people I remember went to the other extreme and they were talking about the future is always going to be only webinars and everything digital. So my only conclusion from that would be we should learn from the mistakes from that execution because we went into again doing everything digital and pushing everything to the doctors, and we created actually digital fatigue in the doctors. So we need and on because all the other things that they had to manage. I would say learning from those mistakes would be taking the step back and thinking about the customer needs, understanding them, and then focus on using the data to improve that experience. That for me, I would say uh, that's the holy grail of improving the ROI in omnichannel.
Thank you.
Yeah, I agree with you. I was thinking about this question, um, and I looked at it from an omni-channel health. The healthcare solution kind of made me think because during the pandemic, we deployed home health, we deployed at-home nurses, wearables, our ROI. But then, as Chema pointed out, we had this digital fatigue, and then there was a weird time where everyone thought the metaverse was going to be the next big thing, and augmented reality and virtual reality. And I think that's
True.
where people invested money in, and then they realized no one wants to go to the conferences and try on the same pair of goggles that 1,000 other people have tried on, and they didn't take that into consideration. Like I'm again, know your customer and ask yourself, would I want to try these things on? Even though it's cool, it can maybe you could go in, you could look at whatever medical information you're trying to scale at that point in time, but will people who take very good care about their hair, would they want to mess it up for a 3-minute demonstration, or is that going to be a waste, right? Like every time I go to conferences and somebody says, "Hey, you want to try this our VR?" I'm like, "No, I'm good." Sorry.
Yeah.
Sorry, but
So,
no.
so exactly. So I would have been in that meeting and said, "Hey, I'm one of those people within your customer segment that would have said this is not for me."
True. True.
Agree.
Okay, guys. So we are 2 minutes away. So I will say we will close this. I will bring one comment regarding to what we were discussing before of Barry. Getting away from silos and data paralysis is a challenge for the larger companies. Let's hope AI doesn't add complexity. So I see Tim nodding.
Yeah.
And with that, I will thank everyone for being here. Our speakers, Tomasz, Chema, thank you so much. We will create another talk show to discuss the question from Sandra, and we will bring her to the floor. So, Sandra, get ready for that. And with that, I hope everyone had a great time with us. And we will see you next time on our next events. So, thank you all and see you. Bye bye.
Take care, everyone.
Thank
Thank
you.
you so much.